everyone!
Welcome to
Better English!
You are sitting in a waiting room. The doctor calls your name. You walk in, she asks you something, and you freeze. You know what you feel, but you cannot find the words in English.
That moment is so uncomfortable. You know your body. You know something is wrong. But the words just are not there when you need them most.
After this episode, that moment will not happen again. You will know exactly what to say, from making the appointment to leaving with a prescription.
We tell a story together. We slow it all down. Real English. Natural phrases. The kind you can actually use. By the end, you will have the doctor vocabulary you need for real life.
Here is the first thing you need to know. In English, when you visit a doctor, you are called a patient. The person treating you is called a doctor or a physician. Think about that. Patient and physician. Those two words are the start of every medical conversation in English.
Let that sink in. Patient and physician. Every time you walk into a clinic speaking English, those are your two anchor words. Okay, let us get into the story.
Let us start at the very beginning. You feel sick. Maybe you have a sore throat. Maybe your stomach hurts. Maybe you just feel very tired for many days. The first step is always the same. You need to make an appointment.
Making an appointment means calling the clinic and choosing a time to see the doctor. You are not walking in and hoping for the best. You are booking a slot, just like booking a table at a restaurant.
And just like a restaurant, they will ask you questions. The receptionist, the person who answers the phone, will ask for your name, your date of birth, and the reason for your visit.
The reason for your visit. I remember the first time I had to say that on the phone in English. I had a pain in my side and I did not know how to describe it. I just said, I have a pain. She asked where. I said on the right side, kind of low. That was enough. Simple words work.
Here is the first key concept. You do not need to diagnose yourself on the phone. You just need to describe what you feel. Here it is again. You do not need to diagnose yourself. You just need to describe what you feel.
That is such a relief to hear. You are not a doctor. You are not expected to know the medical name. You just say what is happening in your body.
So here are the phrases that work every time. Say, I would like to make an appointment. Then say, I have been feeling unwell. Or say, I have a pain in my chest. Or say, I have had a fever for 2 days. Short, clear, honest.
Before we go further, if this is making English at the doctor feel less scary, hit subscribe. We put out new videos every week, and I do not want you to miss them.
She is right. Now, back to the phone call. The receptionist may also ask you, is this urgent? Urgent means it cannot wait. It is serious right now. If you are in strong pain, or you feel very unwell, say yes, I think it is urgent. If it can wait a day or two, say no, it is not urgent, but I would like to see someone soon.
2 more phrases you might hear on the phone. We have an opening on Thursday at 2. An opening means a free slot, a time when the doctor is available. And can you come in tomorrow morning? Come in means arrive at the clinic in person. Does that sound familiar? You have probably heard both of those phrases before.
One more thing before we leave the phone call. Always repeat the time back to them. Say, so that is Thursday at 2. Is that correct? This is normal, this is polite, and it makes sure you have the right information.
Okay, you have the appointment, you wrote it down. Thursday at 2. Now you just have to get there. And that is exactly where we go next.
It is Thursday. You walk up to the clinic, you push open the door, you see a front desk with a person sitting behind it. This is the reception area. And the person there is the receptionist. The same word we used on the phone.
Walking into a clinic in a foreign language is a strange feeling. I once walked into a doctor's office in another country and just stood there for a second too long. The receptionist looked at me, I looked at her. Then I said, I have an appointment. 3 words. It worked.
I have an appointment is your opening line every time. The receptionist will then ask for your name. She will look you up in the system, meaning she will find your details on her computer. Then she will confirm your appointment.
Confirm means she checks that everything is correct and tells you, yes, we have you here at 2 o'clock. After that, she will usually say, please take a seat in the waiting room. Take a seat simply means sit down. The waiting room is the area with chairs where patients wait before seeing the doctor.
Here is a key concept for this part. In English clinics, you often fill in a form before you see the doctor. The form asks for your personal details, your name, address, date of birth, and also your medical history. Medical history means the health problems you have had in the past.
Think about the last time you filled in a form at a new clinic. It can be a lot of information, but the questions are almost always the same. Do you have any allergies? An allergy means your body reacts badly to something, a medicine, a food, or something in the air. Are you currently taking any medication? Medication means medicine. Currently means right now.
Here it is one more time, your 2 most important form questions in English. Do you have any allergies? And are you currently taking any medication? Let that sink in for a second. Those 2 questions come up at almost every clinic visit in an English-speaking country.
And the answers are simple. If you have no allergies, say no known allergies. If you do have one, say I am allergic to penicillin, or whatever the allergy is. For medication, say I am not currently taking any medication, or I take a blood pressure tablet once a day.
Once you hand the form back, you wait. The waiting room is usually quiet. There might be magazines, there might be a television. You just sit and wait until someone calls your name.
And when they call your name, that is the moment. You stand up, you follow them, you walk through that door. And that is exactly where we go in the next part, because what happens inside that room is what most people are most nervous about.
The door closes behind you. It is just you and the doctor now. She sits down. She looks at you. And she says the most common opening question in any doctor's visit. So what brings you in today?
What brings you in today? I love that phrase. It is so warm. It is not state your problem. It is an invitation. It is the doctor saying, tell me what is going on. And that is exactly what you do.
Your answer starts with one of 3 phrases. I have been feeling. Use this for something that started a few days ago and is still happening now. I have a pain in my. Use this to point to a specific place in your body, or I noticed something. Use this for something new or unusual that you observed about your body recently.
Ask yourself this. When you feel unwell, can you describe it in simple words? Usually, yes. I have been feeling very tired. I have a pain in my lower back. I noticed a rash on my arm. You do not need medical terms. You need honest, simple sentences, and the doctor will take it from there.
Now, here is something that trips people up. The doctor will ask you to describe the pain or the feeling in more detail. She might ask, how would you describe the pain? And this is where people go quiet, because they are searching for the right word in English. They know what they feel, but they cannot name it.
Right. A lot of people think they need to know advanced medical vocabulary to describe pain accurately. But actually, doctors use a small set of simple describing words every single day. And once you know them, you can describe almost any kind of pain in English clearly and confidently.
Here are the words. Sharp means a sudden stabbing feeling, like a knife pressing into one point. Dull means a low, heavy, ongoing ache that sits in the background and does not go away. Burning means it feels like heat or fire just under the skin. Throbbing means it pulses. It goes strong, then a little lighter, then strong again, like a heartbeat repeating in your body.
I had a throbbing headache once for 3 days, and I just kept saying, my head hurts a lot. The moment I learned the word throbbing, I used it with a doctor, and she immediately knew exactly what kind of headache it was. She even told me what was causing it based on that one word. One word changed the whole conversation.
Here is the key concept: sharp, dull, burning, throbbing. Those 4 words will cover the vast majority of pain descriptions in English. Think about that. Sharp, dull, burning, throbbing. 4 words. Most pain in the English language described.
The doctor will also ask about timing. When did it start? Means what day did you first notice it? Or how many days ago did this begin? Is it constant? Means does it hurt all the time without any break or relief? Does it come and go? Means does the pain or feeling appear, then disappear for a while, then come back again?
And she will ask about severity, meaning how strong or serious the pain feels to you. She will often ask you to rate it on a scale of 1 to 10. 1 means almost no pain at all. You can barely notice it. 10 means the absolute worst pain you can imagine. You just say a number. It is about a 6, maybe a 4. That single number gives the doctor a lot of useful information very quickly.
There are also a few more questions the doctor almost always asks during the consultation. Does anything make it better? Means, is there something that reduces the pain or makes you feel more comfortable, like lying down, applying heat, or taking a painkiller? Does anything make it worse? Means, is there something that increases the pain or triggers it, like moving in a certain direction, eating, or standing for a long time?
You might also hear the doctor ask, "Have you had this before?" This means, did you experience the same symptom or feeling at any point in the past? If yes, say yes, I had something similar about 2 years ago. If no, say no, this is the first time. Both answers are equally useful. Neither one is wrong.
And she might ask about other symptoms. Symptoms are the signs and feelings your body is giving you. Everything you notice that is different from normal. She might say, have you had any fever? A fever means your body temperature is higher than normal. You feel hot, you may sweat, and you may feel cold at the same time. She might ask, have you had any nausea? Nausea means the feeling that you might vomit, that uncomfortable, unsettled feeling in your stomach.
One last thing for this part. The doctor may need to examine you. Examine means she will use her hands or a medical instrument to physically check part of your body. She might say, "Can I take a look?" Or, "I am going to examine you now." She might press gently on your stomach and ask, "Does this hurt?" She might look inside your ears or throat using a small light. She might listen to your chest with a stethoscope, the round instrument with 2 earpieces that doctors use to hear your heart and lungs clearly.
And she might say, take a deep breath. That means breathe in as far as you can, fill your lungs completely, and hold it for just a moment. Or she might say, breathe normally, which means just relax and breathe at your usual pace. You are doing great. You have described your problem clearly. You have answered her questions. Now she needs to tell you what she thinks, and that is exactly what we cover in the next part.
The doctor has listened. She has examined you. Now she sits back and tells you what she thinks. This is the part where a lot of English learners feel lost, because suddenly the language gets more medical and the sentences get longer.
And this is the part where it is okay to slow things down. You are allowed to ask the doctor to repeat herself. You are allowed to say, I am sorry. Could you say that again more slowly? A good doctor will never mind. She wants you to understand.
Here is the key concept for this part. You always have the right to ask for a clearer explanation. Always. The doctor works for your health, and your health depends on you understanding what she says. Here it is again. You always have the right to ask for a clearer explanation.
Let us talk about what the doctor might tell you. She might give you a diagnosis. A diagnosis is the name of the condition or illness she thinks you have. She might say, I think you have a chest infection, or it looks like you have pulled a muscle, or your blood pressure is a little high.
A chest infection means bacteria or a virus has affected the area inside your chest where you breathe. A pulled muscle means a muscle has been stretched or torn slightly, usually from movement or exercise. Blood pressure is the force of your blood moving through your body. High blood pressure means the force is too strong and needs to be managed.
You might also hear the word inflammation. Inflammation means a part of your body is swollen, red, or irritated, usually because it is fighting something. The doctor might say, "There is some inflammation in your throat." That means your throat is irritated and slightly swollen.
Now here is the word that English learners often misunderstand. The doctor might say, quote, "It is not serious." A lot of people hear this and feel dismissed, like she is not taking them seriously. But in English, not serious does not mean your pain is not real. It means the condition is not dangerous or life-threatening. She is giving you good news.
That makes so much sense. I think a lot of people leave a clinic feeling confused or slightly upset after hearing that phrase. Now, I will never hear it the same way. Not serious means you are going to be okay.
Good. Now let us talk about what the doctor recommends. Recommend means she suggests something for your health. She might say, "I recommend you get some rest." Rest means sleep and reduced activity, staying home, not working hard, letting your body recover. She might say, "I recommend you drink plenty of fluids." Fluids means water and other drinks, keeping your body hydrated.
She might also say, "I am going to refer you to a specialist." Refer means she is sending you to another doctor who knows more about one specific area. For example, a heart specialist or a skin specialist. A specialist is called a consultant in some countries and a specialist in others. Both words mean the same thing: an expert doctor for one area of the body.
And she might say, "I am going to order some tests." Tests in a medical context means examinations of your blood, urine, or other parts of your body to get more information. She might order a blood test. A small sample of your blood is taken from your arm with a needle and sent to a laboratory. She might order an X-ray, a scan that creates a picture of the inside of your body, especially your bones.
I had a blood test once, and I remember being so nervous about the vocabulary. The nurse asked me, "Which arm do you prefer?" I had no idea what to say, so I just said, "This one," and held out my left arm. It worked perfectly. Sometimes simple is better than complicated.
Here is one more phrase the doctor uses a lot. She might say, "I want to monitor this." Monitor means watch carefully over time. She is not alarmed, but she wants to keep an eye on how things develop. She might say, "Come back in 2 weeks and we will monitor it together."
And if you still do not fully understand the diagnosis after all of that, ask this one question. Say, "Can you write that down for me?" A good doctor will write the name of the diagnosis and the key instructions on a piece of paper or print it for you. Then you can look it up later in your own language. That is not cheating. That is smart.
The appointment is almost over. The doctor has told you the diagnosis. She has explained what she recommends. Now she writes something on a small piece of paper and hands it to you. This is called a prescription.
A prescription is a written instruction from the doctor that tells a pharmacist, the person who works in a pharmacy and prepares medicines, exactly what medicine to give you, how much, and how often. You take the prescription to any pharmacy and they will prepare your medicine. It is a straightforward process once you know the vocabulary.
Let us learn the key words around medicine right now. The medicine itself can be called medication, medicine, or a drug. All 3 words mean the same thing in this context. The specific amount you take each time is called the dose. The instructions for how often to take it and when are called the dosage instructions.
The pharmacist might say, "Take 1 tablet twice a day with food." Tablet is another word for pill, a small solid piece of medicine you swallow with water. Twice a day means 2 times in 1 day, usually morning and evening, roughly 12 hours apart. With food means you should eat something before or while taking it. This is to protect your stomach from irritation.
Here is the key concept. When you receive medicine in English, there are 5 questions you should always be able to answer. How many do I take? How often? At what time of day? with or without food, and for how many days. One more time. How many, how often, what time of day, with or without food, and for how long. Keep those 5 questions in your head every time you pick up medicine.
Those 5 questions will keep you safe and make sure you are taking your medicine correctly. If the pharmacist gives you instructions and you are not completely sure about any of those 5 points, ask. Say, I am sorry, how many do I take each time? Or, should I take this with food or without? They will always answer clearly. It is a completely normal question, and they are used to it.
Now let us talk about the different forms medicine can come in, because a doctor might prescribe something that is not a tablet. A syrup is a liquid medicine. You measure it with a small cup or spoon and drink it. A cream or ointment is a medicine you apply directly to the skin by rubbing it in. Drops are liquid medicine applied to the eye, the ear, or the nose. An inhaler is a small device you breathe medicine from directly, commonly used for conditions that affect the lungs and breathing.
I once had an eye infection, and the doctor prescribed drops. She said apply 2 drops to the affected eye 3 times a day. Affected means the one that has the problem. So the eye that was infected. I had never heard that word used that way before, and it took me a moment. But once I understood it, everything was clear.
There are also important warning labels you might see on medicine packaging in English. Do not exceed the stated dose means do not take more than the instructions say. Taking more will not help you recover faster, and it can be harmful. May cause drowsiness means this medicine might make you feel very sleepy. If you see this, do not drive a car or operate any heavy machinery while taking it.
Another common label is keep out of reach of children. This means store the medicine in a place where children cannot find or access it. And store in a cool, dry place means do not keep it in a warm or humid location, like directly in a bathroom or in sunlight. These labels are there for your safety, and they are always worth reading.
The pharmacist might also tell you to finish the full course. This means even if you start feeling completely better before the medicine runs out, you must keep taking it until it is finished. This is especially important with antibiotics, medicines that fight bacterial infections. If you stop taking them too early, some bacteria may survive, and the infection can return, sometimes stronger than before.
And if you have a question about whether 2 medicines are safe to take together, ask the pharmacist. Say, I am also taking this. Is it safe to take both? The pharmacist is trained exactly for this. That question is completely appropriate and possibly very important for your health. Do not skip it out of embarrassment.
Now, you have your medicine and your instructions. You are ready to leave. But before you walk out, there is one more possible step. The doctor or receptionist might schedule a follow-up appointment. Follow-up means a second visit after your treatment has started, to check that the medicine is working and that you are improving. They might say come back in a week, or book a follow-up in 10 days if you are not feeling better.
If they do not automatically schedule a follow-up and you are still worried, it is completely acceptable to ask for one. Say, should I come back if I am still not feeling better? The answer will always tell you what the threshold is, meaning at what point you should return. That information is important to have before you leave.
Let us also make sure you know one emergency phrase before we close this part. If at any point, inside a clinic or anywhere else, you feel the situation is very serious and cannot wait, say these words clearly and directly. I need help right now. Or go directly to the emergency room and say, I need to be seen immediately. The emergency room, sometimes called the ER, is the part of a hospital that handles urgent and life-threatening situations around the clock, every day of the year.
In British English, the emergency room is called accident and emergency, shortened to A and E. In American English, it is the emergency room or ER. Different name, same place, same purpose. If you ever need it, either phrase will be understood immediately and will get you the help you need. Okay, let us go to the outro and bring everything together.
Let us take a moment and look at how far you have come in this one episode. You started not knowing what to say in a waiting room. Now you know how to make an appointment on the phone, check in at the reception desk, describe your symptoms with real vocabulary, understand what the doctor tells you, and leave the clinic with your prescription and your instructions.
And the vocabulary you picked up along the way. Patient, physician, receptionist, diagnosis, prescription, dosage, inflammation, referral, follow-up. Those are not just words. Those are tools. Real tools you can use the next time you walk into a clinic anywhere in the world where English is spoken.
Think about that. You walked into this episode not sure what to say. You are walking out with the vocabulary of a confident patient. That is a real shift.
If something clicked for you in this video, type "I got it" in the comments. I read every single one. It genuinely means a lot to hear which part helped the most.
Here is your real-world challenge for today. Tonight or tomorrow, open your phone and write out 3 sentences in English describing how you feel right now. Even if you feel completely healthy, practice it. I feel well today. I have no pain. I slept well last night. Or if something is bothering you, describe it. Use the words from today. Sharp, dull, burning, throbbing. That small habit will make the real moment much easier when it comes.
Writing it out is such a good idea, even just once. It moves the vocabulary from something you heard to something you actually used.
If you made it to the end of this episode, you now have English vocabulary that most everyday English speakers never even think about consciously. You have it on purpose. You built it deliberately. If you found this useful, please like this video and subscribe. It helps us keep making episodes like this one, and it means you will see every new one as soon as it comes out.
And if you want to keep building your English for real-life situations, our next video is about what to say at a pharmacy. When you arrive without a prescription, when you need to ask about side effects, and when you are not sure which medicine is right for you. It is the natural next step after everything we covered today. Thank you so much for spending this time with us. Keep going. You are doing better than you think.
Your English journey does not end here. Watch more videos and keep practicing.